Hi to those of you who are just joining us. We're going to give people a few minutes to get logged on, so please hang tight. Welcome to those of you who are just joining us. We're going to give maybe another 2 minutes for people to get logged on, so please just hang tight. All righty, it looks like we're sort of stabilized with participants. So I think I'm going to go ahead and get us started because we have a lot of exciting presentations for today. Hi, everyone who hasn't met me yet. My name is Hillary Godwin, and I'm the Dean of the UW School of Public Health. And today I am super excited that we have several students from our undergraduate public health global health major who are going to share key findings from their research on COVID-19. Which they conducted as part of the course that they're taking on public health research methods, which is SPH 480. And we're also very excited to have with us here today the course's autumn 2020 instructors. So before we continue, I'd like to acknowledge that even though we are meeting in Zoom world, that we are all calling in from Indigenous lands. I happen to be calling in from the Indigenous lands of the Suquamish people. And in Seattle, where many of you are calling from, we of course acknowledge the Coast Salish peoples of this land, which touches the shared waters of the tribes and bands within the Suquamish, Tulalip, and Muckleshoot nations. But wherever you may be tuning in from, I hope that you will join me in honoring with gratitude and respect the Indigenous peoples who are still here and on whose land we are guests. As members of the public health community, we commit to being better stewards of the land we inhabit and partnering with tribes to improve the health of all people. I'm hoping that you guys can't hear all of the hubbubaloo that's going on in the background in my house, but if you can, I apologize for it. I'm not quite sure what's happening, but people are very excited about something. So a bit of housekeeping. These webinars are designed to keep our community informed and connected as we work and study remotely. We welcome any alumni or members of our UW community to join us. And just want to remind you, though, that sometimes I give some specific information about sort of like what our plans are or how we're handling different things with the pandemic. And those tend to be specific to the School of Public Health. So if your primary affiliation is with a different school or a different organization, be sure to check with your supervisor. And I want to give a special shout out to any admitted students that may be tuning in. Our admissions process this year was run almost completely or completely virtually. We offer congratulations and welcome to our admitted students, and certainly wish you luck on your graduate school journeys. As a reminder, we do not use the raise hand function in these webinars just because there's usually too many people for us to track who's raising their hand and who's not. So if you have questions, please use the Q&A function. We do use the chat box, but we use it for sharing information or just like little kudos. So people are welcome to put stuff in the chat box, but if you have questions, please put those in the Q&A box. So with that, let's go ahead and get started. So our panelists today are Jen Sliker, who's an associate professor of global health and adjunct associate professor of epidemiology. who serves as our Associate Director for the Public Health Global Health undergraduate major. Woohoo! And we also have Kate West with us, who is a clinical assistant professor in global health and an alumna of our PhD program in public health genetics. And Jen and Kate teach SPH 480, which is research methods in public health. And then we also have with us here today several undergraduate students from that class. So we have Jamie Costales. Jamie, if you want to wave. Anjali Raja. Sofia Solomon. Nikole Pham. Nora Oyama. Loic Marcon. Mary Fudge. And last but not least, Maddy VanSpeybroeck. So before we jump into today's topic, I'm just going to give you some quick updates on what's going on in terms of the state of the pandemic. We always start by acknowledging those who we have lost in the last year and the loved ones that members of our communities have lost. And that's particularly sobering right now, where at this point, there have been over 117 million confirmed cases of COVID-19 worldwide and over 2.6 million deaths. Here in Washington state alone, we've had more than 326 confirmed cases of COVID-19, almost 20,000 hospitalizations, and more than 5,000 deaths. It's hard to believe, but yesterday we marked the 1-year anniversary of our transition to working and learning from home. And it's been such a hard year for so many reasons. And I just want to call out the amazing work that all of you have done during this last year to help our public health practice partners, to help our own organization through the pandemic, to work towards health equity during this time. And just each and every one of you for the incredible resiliency that you have shown during this year. I particularly want to give a shout out for those of you who have doubled down on your equity, diversity, and inclusion activities during this last year. Those activities are so core and central to our values in public health. And I think, this is a time when more than ever we need to be engaging in those activities, particularly given how difficult this past year has been in terms of witnessing racism and violence against people of color in our communities. So some good news, as you all probably are aware, we now have 3 approved vaccines, including Merck is now partnering with Johnson & Johnson to speed up production of the Johnson & Johnson vaccine, which is a single dose vaccine. That has made dramatic changes just in the last week and a half in terms of our expectations for how much vaccine we will get in the near future. And so things are really looking up in terms of getting people in our community who want to get vaccinated that vaccine. As a reminder, you probably hear a lot in the media about differences in specific efficacies of the different vaccines or how good they are against different variants. And I guess my big call for public health people is to please continue to remind people that while we care in public health about efficacy from a public's perspective, the most important statistic in terms of each of the vaccines is how good they are in preventing hospitalizations and death and severe disease. And what we know is that all 3 vaccines do a fantastic job by that criteria against all known variants. So really, if you have a chance to get any one of the 3 vaccines or your loved ones do, please take it or encourage them to take the vaccine. And certainly for those of you who are working on ensuring that we're getting equitable distribution of vaccine, that is front and foremost in many of our minds, and please continue that good work. Okay, so with that, I think I'm going to shift over to our main part of the program so that we have time to hear from all of our students. And somehow I'm back to page 2, so that's not right. Where are we? 5. Okay. Diving into the presentation, I'm turning it over to Jen and Kate to tell us a little bit about their course and what we're going to hear about today.
Terrific. Thank you so much. Oops, I'm going to shrink y'all's pictures. Okay, great. Thank you so much, Hillary. So before our students share the highlights from their remarkable research, I'm going to provide just a short intro to set the stage for what they'll tell you about. The research you'll hear today are all projects from our Research Methods course. There are 3 class projects and 1 is an honors ad hoc project. In our class, students learn research methods by developing, conducting, and analyzing a cross-sectional research study, and then writing a brief written report. This year, of course, most student groups decided to study COVID-19. And the work you're going to see today is from Autumn Quarter, which was taught by Kate West and myself, and our TAs were Dong-Hoon Lee, Kate McConnell, and Deanna Tollefson. Oops, oh, there we go. So how, you may ask, do the students design, execute, and write up an entire research study in the bounds of a 10-week quarter? It is ambitious. We use a flipped classroom model of instruction. Students are organized into teams of 5 to 7 learners. At home, the students watch a collection of short videos that set up each week's exercises. And then in class, they complete daily deliverables, which break down the research process into small, discrete steps. And then each week, these are reviewed by their coach, who is an instructor or a TA, whereby they get detailed iterative feedback as they design their study. And then the bulk of this work is done within class, which is spent working on deliverables and discussing the work with their coaches. These deliverables are then collated into their study proposal. Then they collect their data, analyze it, and write up their written report. And because of this very tight timeline, we have specific constraints around how they can do their study. It has to be cross-sectional and have 1 descriptive and 1 analytic aim. It must be done in a UW population, be devoid of any participant identifiers, and clearly stated to be an educational exercise. The coaches closely review and pilot the survey, which must contain a mini consent script, warnings about potentially difficult or emotional questions, and links to appropriate resources at the end. Some of you probably in this audience have taken our surveys. So here's an example of one of our daily deliverables to create a specific aims page. So this example takes them through developing a research question, aims, and hypotheses. Most of the deliverables follow the same general format with instructions, discussion points, and then a template which they complete in class. They're listed over here on the left, each one of our individual daily deliverables. And then we also have peppered throughout the quarter complementary intro sessions into other research methodologies that aren't part of their big project, but we ask them to envision how these methods could be applied to their study. And these include implementation science, community-based participatory research, qualitative research, and reflexivity. And that is really where I will stop. And you can spend the rest of this time hearing the great student presentations, and I'll hand it back to you, Hillary.
Hillary, you're muted.
I can't hear you, Hillary.
Just as you said that, it came up on my screen. It's like, you need to unmute. Thank you, Jen and Kate. And yeah, let's hear from our students. So our first group that we have up are represented by Anjali and Jamie, and they're going to discuss their project on the effective COVID-19 risk perception on adherence to COVID-19 preventive measures.
All right, thank you, Dean Hillary. I'm going to share my screen. And hopefully you can all see our title slide. Perfect. All right, so hi, my name is Jamie Costales.
And I'm Anjali Raja.
And we're here to present our COVID-19 findings from last quarter as our team studied the effect of COVID-19 risk perception on adherence to COVID-19 preventive measures.
We want to give a special shout out to our team members, Joanna Duzon, Joe Kurum-Kote, Megan McHenry, Hannah Mikas, and Carly Vigilia. Our formal research question was, is an individual's perceived risk of getting COVID-19 associated with their adherence to preventive guidelines among university students over the age of 18? Listed here on the slide are our two aims. Our descriptive aim was to determine the level of perceived risk of COVID-19 infection among UW students using a 1 to 5 Likert scale. We hypothesized that UW students will score low on average on this 1 to 5 scale of perceived risk of COVID-19 infection. Our analytic aim was to assess the association between the perceived risk of COVID-19 and adherence to preventive measures such as hand washing, mask wearing, and social distancing among UW students. Lastly, we decided to test the confounding variable of having a chronic health condition. The reason for this was we hypothesized that those with a chronic health condition would have a greater risk perception and then also have a greater adherence to COVID-19 preventive measures.
Our rationale for conducting this study was to better understand attitudes and behaviors of young adults, specifically our peers, in regard to COVID-19 to improve targeted behavior change. For example, if we found that our peers felt that their risk of getting COVID-19 was low, we could help create more directed educational interventions that reiterated the severity of the disease to improve participation within COVID-19 precautions such as social distancing. Before sharing our results and conclusions, we wanted to share that our methodology included administering a Google survey through email and social media to 139 students during autumn quarter 2020. These surveys asked a series of questions that assess perceived risk of getting COVID-19. For example, how worried are you about contracting COVID-19, along with adherence to COVID-19 preventive measures, examples of which will be shown on our next slide. As our possible score values range from 1 to 5, with 1 indicating very low risk perception and 5 indicating very high risk perception for COVID-19 infection, our results showed that UW students had a mean risk perception of 3 with a standard deviation of 0.66, which you can see here, which means that they were neutral and indifferent to categorizing themselves as either high or low risk. The mean adherence was 4.5 with a standard deviation of 0.5. This means that the adherence to COVID-19 preventive measures was relatively high. Overall, our studies showed that UW students had a neutral risk perception, yet a high adherence to COVID-19 preventive measures.
So as you can see on the slide, the confounder was present in about 15% of our study population, which is a significant amount. When we compared these crude prevalence ratios to the adjusted prevalence ratio, we saw that they were equal to 1.1, and we'll see this later in our AIM2 results as well. And what this means is that both groups showed that the high adherence to preventive measures was 10% higher in UW students with high levels of perceived risk relative to students with low levels of perceived risk. Therefore, our confounding variable did not impact the association between the exposure of risk perception and the outcome of adherence to preventive guidelines.
And then here we just have a table showing examples of how adherence was addressed and the average scores for the prompts.
All right, so now we're going to just go into our second AIMS results. So there seemed to be no significant evidence of a strong association between risk perception and adherence to preventive measures for this study population. So on the graph, you can see that the R-squared value is about 0.0595, which really means that only about 5.95% of the variation in average adherence to COVID-19 preventive measures can be explained by a change in average COVID-19 risk perception.
At the end of our study, our limitations included selection bias with oversampling of public health students and our own social networks, and inability to determine temporality as we measured exposure and outcome at the same time. Therefore, we could not determine whether exposure was caused by the outcome or vice versa. There can also be low generalizability due to the timing of our study, which was done in the fall of 2020 during one of the peaks of COVID-19, meaning that the risk perception and preventive adherence to COVID-19 may be lower now due to vaccines and media messaging. Different universities across the country can also have different COVID-19 messaging or policies that affect risk perception. Going forward, further work that could be done would be to stratify the population by demographics such as socioeconomic status and/or race to further inform behavioral change interventions. We hope you enjoyed learning from our presentation as much as we enjoyed conducting it. Yep, thank you for your time.
That was fantastic. Thank you guys. I have lots of good questions for you, and I can see we're starting to get questions in the Q&A as well, but I'm going to ask people to, and you can post your questions now, but we're going to ask them after everyone is done, just so that we make sure that we give all the groups time to speak. Okay, so our second group is Sofia, Nikole, and Nora, and they are going to share their insights about undergraduate students' comfort and engaging in social behaviors during the pandemic, based on whether they lived on or off campus. Turn it over to you guys.
Hello, everyone. I'm Nora Oyama.
I'm Nikole Pham.
And I am Sofia Solomon. And today we will be presenting our honors ad hoc presentation to you. We are so excited to be presenting today and welcome any questions at the end of our presentation. So for our research project, we asked whether there was an association between UW students' living location and proximity to the UW campus and their level of comfort participating in social behavior. Our aims were to determine the association between living location and social behavior in UW students, and to determine the mean comfort score of UW undergraduate students' social behavior during the COVID-19 pandemic. We believe that our project is of importance because from the start of the 2020 autumn academic quarter to the end, UW positive COVID-19 cases doubled for those tested through the Husky coronavirus testing program. For undergraduate students, living location in relation to a university can potentially affect a student's social behavior due to peer influence and increased social activity around the campus. We hypothesized that there would be a positive association between those living on campus and higher comfort level engaging in social behaviors during the pandemic. An undergraduate's risk for severe COVID-19 infection may have altered this proposed association of interest and was further analyzed for its impact on outcome. The goal of our project was to collect data and provide information on the attitudes and social behaviors of young adults in college during the COVID-19 pandemic. We hope that the results from our project can help the UW better understand their students during this unprecedented time.
So our research team conducted a cross-sectional survey in which participants answered survey questions relating to the exposure, outcome, and confounder at the same time. We administered our survey via an online platform with a Google Forms survey from November 24th to December 8th, 2020, using listservs and social media, including Instagram and Facebook. Those eligible for our study were UW undergraduate students aged 18 to 23, living in Washington State at the time of our survey conduction, and who are full-time students, defined as taking more than or equal to 12 credits. Living on campus was defined as living in the university district, which is depicted by the red circle in Figure 1, while living off campus was defined as living outside of that specified region. The comfort scale, created by the research team, consisted of 10 questions that asked individuals about their comfort engaging in specific social behaviors. Each question, measuring the outcome of social comfort, was then converted into a score, ranging from 0, which meant not comfortable, to 3, very comfortable. A high cumulative comfort score was determined to be a score of 15 or higher, which was the mid-range value of our scoring scale. Self-perceived risk was evaluated as a potential confounder and was measured as the potential for severe infection to COVID-19 for either themselves or for someone in their household, and that was categorized into either high or low. Of those eligible, we had a total of 91 respondents. Looking at Table 1, the mean age was 20.4 years old, 85% of the respondents identified as female, and 15% as male. In regards to our exposure, proximity to the university, 68% of respondents said they lived on campus and 31% said they lived off campus. In regards to our confounder, self-perceived risk of COVID-19, 25% indicated having a high self-perceived risk, while 75% indicated having a low self-perceived risk.
Beginning with our analytic aim, we found that on-campus students were 46% more likely to report high comfort scores than students who lived off campus. This leads us to believe that students living on or near the UW Seattle campus are more comfortable engaging in social behaviors that could potentially increase the risk of contracting COVID-19. Additionally, we discovered that the average comfort score of a student living on campus was 13.2 out of 30 possible points, compared to the average of an off-campus student at 11.3.
The higher mean comfort score among students living on campus suggests higher comfort engaging in risky behaviors associated with COVID-19 infection. Table 2 shows the 10 questions we asked to assess our outcome and their associated mean scores. From the scores reported, many individuals seemed comfortable seeing family members and friends in a socially distanced environment and were comfortable going out for essentials, whereas many people were not comfortable taking public transportation or gathering with 5 or more people who lived outside of their household. When adjusting for self-perceived risks of COVID, we discovered an 11% difference between the crude and adjusted prevalence ratio, demonstrating that the perception of one's infection risk was a confounder. This association could reflect how those living on campus reported having a low infection risk and having higher comfort scores. Furthermore, students who reported their self-perceived risk to be high were 32% less likely to report high comfort scores than students who stated their self-perceived risk to be low. Our results found that those who reported low self-perceived risk were more comfortable in partaking in social behaviors compared to those with self-perceived high risk. At the time of our study, there was still a lack of information in the existing literature regarding attitudes and behaviors of young adults towards COVID-19. We hope that our research will provide more data on the association between living location and social behaviors among college students during the COVID-19 pandemic. Furthermore, we hope this information can be used to help universities better understand the needs of their students and better support them during this difficult time. Thank you for your time, and we look forward to answering any of your questions after the other presentations.
Thank you so much. Whew, that was awesome. Again, I have lots of questions, but I'm going to hold on to them. For group 3, we have Loic, who's speaking on behalf of his research team. They looked at association of social media use on fear of COVID-19 amongst UW undergraduate students.
Hi, sorry, I just had to unmute myself. One sec. Can you all see my screen?
You can see your screen, but it's not in presentation mode.
Perfect, no worries.
Okay.
Just need to adjust. All right, and here we go. Perfect.
Great.
All right. Thanks so much for that, Nikole, Sofia, and Nora. Hi, everyone. My name is Loic Marcon, and I will be presenting on our group's study titled Measuring the Association of Social Media Use on Fear of COVID-19 Amongst College Students. I want to give a big shout out to my group mates, Zayan Bustamante, Mika Magbanua, Dan Wen, Ines Ramadane, Ella Strange, and Zin Ta. So at the time of our study's conduction, coronavirus cases were rising on college campuses. This first graph on the left actually comes straight from UW's own case tracker and shows that the peak was actually exactly the week we began school in the fall when folks came back to campus. Interested in the role of social media on perceptions of COVID-19, we began our background research and discovered that in previous studies similar to what we were going to assess, there had been an association between information depicting health protective behaviors on social media and actually enacting those behaviors. At the same time, however, previous research indicates that the more frequent use of social media in certain age groups, the higher the anxiety associated with COVID-19. So college students tend to spend more time on social media, and we thought that there was a need to understand how social media influences college students' perceptions of COVID-19, again, particularly because cases were rising across college campuses in the fall. So we asked, is there an association between social media use and fear of COVID-19 in UW Seattle undergraduates aged 18 to 25 with access to social media? We chose 18 to 25 because we felt it captured the age range of most undergrads, and we figured UW undergraduates were easier for us to reach and were generally representative of college students across the United States. So for this project, we were asked to come up with 2 finding aims, one descriptive and one analytic, as mentioned by my colleagues before. We were able to survey over 130 participants over a 2-week period. We distributed our survey with a promotional flyer across social media and through our classes. And because there were 7 of us working on the project, we were fortunate to get a wide range of respondents. After the data was cleaned, we had 118 full responses. So our descriptive aim was to determine the prevalence of fear of COVID-19 in UW Seattle undergrads. In order to do this, we presented our participants with statements about behavior that might indicate increased caution or fear. One example of a statement might be, when I watch the news and stories about COVID-19 on social media, I become nervous or anxious. These were based on previously validated surveys whose results were published in academic journals. We measured those answers by creating a numerical scale that converted answers from behavioral statements into scores, and you can see that in the table on the bottom of the slide. So we then averaged all scores and classified any participant with a score greater than the average as having high fear and below as having low fear. And we found that 53% of our participants had a higher than average fear level. More interesting though was the mean fear level itself. The lowest possible score was 0, which would indicate that a student had absolutely no fear of contracting the virus. The highest possible score was 32 because we presented them with 8 statements, and if participants answered that they were always afraid of doing something, as you can see in the table, they received a score of 4 for that behavior. So the mean fear level at 14.43 was a little bit below what 50% of highest possible fear was, indicating that college students might be less fearful in general, but compared to their peers, more students felt that they had a higher level of fear. Our analytic aim was to assess the association between frequency of social media use and fear level of COVID-19 in UW Seattle undergraduate students. We used a similar numerical scale to assess time spent on social media, as indicated in the table at the bottom, and found the average and categorized any number higher than the average into high exposure and below into low exposure. As you can see on our graph, higher social media use, which is indicated on the x-axis, was correlated with higher fear levels, indicated on the y. We then calculated our prevalence ratio, the ratio that tells us how strongly an outcome is associated with an exposure. In our study, the exposure was that frequency of social media use, and the outcome was high fear level of COVID-19. However, we found that there was only a 1.11 prevalence ratio and a contained confidence interval with 1. This means that in our study, participants who had high exposure to social media were 1.11 times more likely to have higher fear of COVID-19. Therefore, no statistically significant conclusion could be drawn about a causal inference. We knew that there would be many confounding factors involved in this study, but given the limitation of our 10-week timeframe and accessibility to reliable information about certain confounders, we selected location of residence during the majority of the pandemic up to that point as the confounder to measure. We chose this because different communities face different transmission rates. And it's also important to note that a unique characteristic of the American response to the pandemic was that states had the option to deal with it however they pleased. So for example, a mask mandate was not evenly distributed across location, and businesses were closed at different capacities for different periods of time. As for other countries, they were also likely to experience the pandemic differently than we did in the United States. With location as a confounding factor being one that skews correlations, there was only a 0.45% difference between our accrued and adjusted rates. So that tells us that location was not really a present confounder in our study. Overall, we found that there was an association between frequency of social media use and increased fear of COVID-19. However, it wasn't statistically significant. Additionally, it might not be entirely reliable because data was collected at a very specific point in time during the pandemic when case counts were increasing because of Thanksgiving gatherings. That is also one of the limitations of a cross-sectional study. So our results suggest that college students who frequently spend time on social media are likely to be exposed to more COVID-19 information and likely to report increased levels of fear if the information is difficult to process or is a product of misinformation. In thinking about where this information can take further research, we felt that investigation of social media echo chambers was crucial. Echo chambers and misinformation are an increasingly growing issue and can have serious public health implications. Echo chambers and misinformation can create insulated perceptions of the world and can harm our ability to coexist, which matters when trying to stem the spread of COVID-19. And I think at a time when division on our campus exists in the form of divisive views on how to live around a college campus during a pandemic, this information is more important than ever. Thank you so much.
Yay. All right. And our fourth group also was looking at social media usage and how that impacts people's fear of COVID-19, or students' fear. And presenting for this group, we have Mary and Maddy.
Thank you, Dean Godwin, and hello, everyone. My name is Mary Fudge, and similar to the previous group, the title of our research project is Social Media Use and Fear of COVID-19 Among University of Washington Undergraduate Students. When doing background research for this project, we found several other studies that looked at the association between social media and its influence on the public's perception of health crises like COVID-19. What we found were strong suggestions that social media has a negative impact on mental health and contributes to increased fear of the pandemic. We were interested in studying UW undergraduates specifically because there is no existing literature that we found on this population. And since college students consume more social media than older demographics, they may be more vulnerable to its effects if they are adverse. So we asked the question, is frequency of social media use associated with personal fear of COVID-19 among UW undergraduate students? Together, we designed our cross-sectional study and surveyed over 130 UW undergrads over a 2-week time period using social media outlets like Instagram and Facebook to recruit participants. And we had 2 specific aims or goals that guided our research. One was to estimate the proportion of UW students with high fear of COVID-19, and the other was to assess the association between frequency of social media use and fear of COVID-19. And now my group member, Maddy VanSpeybroeck, will present our results and conclusions. Thank you.
Thanks, Mary. So moving on to our results for our first aim of measuring the proportion of UW students with a high fear of COVID-19. We asked students to respond to several questions about COVID-19 and concerns about their own health, concerns about the health of their loved ones, and more general concerns about how the pandemic has impacted their daily life and future goals. And all of these questions were on a 5-point Likert scale. So we tried to make this assessment as holistic as possible and really capture the nuances of one's emotional responses to the pandemic. And using this data, we calculated a fear score for each individual respondent. And we found that the average fear score was 3.16 out of 5, and that 65.7% of our respondents had a high fear score or a fear score that was above that mean value.
Hey, Maddy,
yes.
Can you just forward the slide?
Oh, yes, I can.
Thank you.
Sorry about that, everyone. Thank you, Dean Godwin. So this tells us 2 things. It tells us that to the extent that our results are generalizable to the rest of the UW undergraduate population, that students' fear levels are not evenly distributed and skew high. We had anticipated that our average fear score would sit closer to 2.5, and that roughly half of our respondents would have a fear score above the mean. And this was not the case. So this suggested to us that UW undergraduates have a lot of fear and anxiety about COVID-19. More so than our research team had anticipated, and maybe more so than the general public would expect. And for our second aim of assessing the difference in fear between high frequency and low frequency social media users, we asked participants to self-report their daily hours spent on social media and used that data to calculate weekly averages. And we found on average that people spent 21.1 hours per week on social media. And keep in mind that this is just time spent on social media and doesn't include any time spent online for school and work and things like that. But using this mean, we split respondents into high and low frequency users and looked for differences between these groups. And we saw about a 1.08-fold increase in fear scores in the high frequency group, but this was not a statistically significant difference that we could infer. But what we did notice as an interesting result was some variance for fear scores based on which social media sites respondents reported using. So if you'll refer to this chart here, we can see that respondents who used Facebook and Twitter had average fear scores that were considerably higher than our respondents who reported not using those social media sites. And we're not totally sure why this is. This was outside of the scope of our survey questions. But to me, it suggests that there may be something about the type of content that is viewed on sites like Twitter and Facebook that inspires more fear in users when compared to the type of content seen on social media sites like TikTok and YouTube and Instagram. And again, this is not something that we can draw clear conclusions from or infer causation from, but in my opinion, it does invite more questions and maybe more research in the future. So we're hopeful that our research can inspire future student teams to look into this question a little more and give the university some insight in how to support their students. Thank you.
Yay, that was awesome. We have tons of questions from our audience. So I'm going to go straight to those questions and actually first start with a lovely compliment from Chuck Tresser, who says, my compliments to all the groups for their presentations and the very polished and professional manner in which their studies were presented. Bravo. Woo! Totally agree. Okay, with that, Chuck also has a question. So he says, since the studies involved interviews with actual students, how did the class address the IRB requirement? Were the students introduced to the IRB process?
I'm happy to take that one.
Yeah, go ahead, Kate.
Yeah, thanks for that question. And that's a question we get all the time, so I really appreciate you bringing that up. So I guess it's a two-part answer. One is that because this is a class project and it's very clearly described as a class project in all of the consent materials and the recruitment materials, it actually doesn't meet the definition of human subjects research that the IRB has to review. Now, that said, we do make it very clear to the students that just because the regulations don't require IRB review doesn't mean that we can just forget about all the principles behind those regulations. And so we do have a whole session where we discuss the Belmont report, the common role, IRBs, what their role is, and what that whole process is. We don't take them step by step through the process, but they're certainly introduced to the concept of research review and the importance of it. And we talk about it in various different contexts. So it is something that they are aware of, and I hope that they'll have a chance to actually do some research that does meet the definition that requires IRB review in the future. But the other thing too is that, and I think Jen could speak more to this, but before, when this course was first being designed in this way, Jen and Sarah Glick, I think, had worked with the IRB to make sure that everything was appropriately, going to be good. Yeah, yeah, Jen, jump in because I think you can speak to this certainly more than I can.
I can just nod and say yes. We did work with the Human Subjects Division to discuss this, and yeah, and they were involved in the design of this process. So thanks for the question.
I'm muting myself. Okay, question number 2 is for group number 1. This is from Dr. Jim Guadino, who is one of our, I believe, adjunct faculty or affiliate faculty, and who has been super active in our webinars. So we're glad to see him here again today. So for group number 1, just curious why the analyses of the ordinal categorical outcomes use methods usually more with continuous outcomes. For example, mean versus median, simple regression. And then he says, interesting project. Thanks, Dr. Jim.
Yeah, that's a wonderful question. Thank you for asking. I'm not sure how much, if we're able to go back, but our graph actually showed
pull it up again if you want to.
Okay, Jamie, would you mind starting that screen share? Okay.
Yes, I can pull it up again. Oops. Do you see the slides?
Yes.
Okay.
So if you go to the graph slide, you can see that we're looking at average COVID risk perception and versus average adherence to preventive guidelines. So to kind of go more in depth as to how we did that, after each person's survey responses came in, we converted their categorical answers. So for example, let's just take mean adherence scores. So if it was very low, then we converted that to a 1. And then if it was very high, then we converted it to a 5. We totaled that up for each question of that survey, and then we averaged it with the number of questions. We did that for every respondent, and then that's what we were graphing. So kind of in short, we turned our categorical data into continuous values that we could graph on this chart to do regressional analysis. I hope that kind of answers your question, but if it doesn't, please let us know, and we can try and clear that up a little bit more.
Great, thank you. Let's see, next question is also from Dr. Jim Guandino for group number 3. He asked, could you please explain the final outcome variable? Was fear of COVID-19 as measured for the risk ratio? Was it a yes, no summarized from the total of fear scores?
Yeah, great question. So I hope I'm going to answer this clearly enough, but essentially what we did is by creating that scale of frequency of, or I guess creating numbers associated with answers, we got obviously a really wide range of numbers. And in order to find that correlation, we needed to split it into binaries. So the yes for the exposure, for example, would be the scores that were above the mean, and the no would be scores that were below the mean. And that was just done for the sake of finding that prevalence ratio and creating the 2x2 epidemiological tables. Yeah, I hope that clarifies everything.
Thanks. Okay, let's see. Another question, this one from an anonymous attendee. How was, and I'm not really sure which group it was, so I'll let you guys jump in if you think it was you. How was fear defined? Whoops, it just jumped. And understood in your studies, given that some level of fear of a known real threat, such as COVID, can be a positive response?
Yeah, I can take this one because we looked as fear as well. We defined it, and here, I'll actually pull it up for everybody real quick. So for our respondents, we defined fear as distress, apprehension, or alarm. So this is what all of our respondents saw as they were taking the survey. And I think that is a really good question. So I would define it as we were looking for students showing signs of de-stress to categorize that, as opposed to like forms of eustress that might have led to more protective behaviors.
Yeah, and I can kind of touch on our assessment of fear as well. I think for us, the thing that we determined was that, yes, fear might not be a bad thing, but we just wanted to look at behaviors that might indicate increased caution. So all of those questions or those statements that we presented were behaviors or actions that would indicate increased caution, kind of similar to what other groups asked their participants, right? We asked about, how do you feel about going onto public transportation? Are you always cautious? Are you frequently cautious? And we didn't want to make any implications or assumptions about whether or not that fear was good or bad, but we just wanted to see whether the prevalence was there because, and I know Maddy and Mary talked about this a bit in their presentation, there does seem to be this perception that college students are not fearful of COVID-19 or are not taking it seriously as we see cases rise across campuses. And we wanted to assess whether that was really true.
Yeah, that totally makes sense. So I think we have, oops, I was just about to say, so good question from Joe Harper Kowalczyk. So he wants to know, what would you study now if you were taking SPH 480 in the spring? So anyone who wants to chime in.
I think there's a lot of potential for research around either perceived personal fear and attitudes towards vaccine uptake and the desire to get vaccinated. When we were doing this research, the vaccines were still on the horizon. So I think there are a lot of ways, and maybe even like, so what you see on social media and how that affects your attitude towards vaccine. I think there's a lot of potential there. So it'll definitely be interesting at the end of this quarter and at the end of spring quarter to see what students are looking at now.
In retrospect, I'm thinking that looking at media messaging, kind of how that's changed over time. So if someone had done research of that maybe in 2020 during like a peak wave versus now when vaccinations are kind of underway and the CDC has released different statements and things like that, and how that kind of impacts people's perceived risk or fear of COVID-19 and getting it and things like that. I think that could be really interesting to study too.
Here's sort of a more like a pulling back from the specifics of what you guys were looking at, but sort of how was your experience of doing this project, and particularly given that it was remote? How did it go? How was the working in teams remotely? Any sort of lesson learned about team dynamics, things like that?
I can take this one. I actually had a really positive experience working collaboratively with fellow people in my major. I feel like it's a great way to get to know someone over Zoom, just because we were able to meet more frequently, I think, than if we were in person, because it's a lot easier to, if you're all in the same place, to sign on at the same time. And thankfully, Zoom is a great platform, but there's other collaborative platforms like Google Drive that make it so easy to work on something at the same time. And I think we got a lot more done than if we were sitting around a table all trying to write on one paper. And I think our voices were able to all be elevated a little bit better that way. So that was a positive outcome that I thought we had.
Did you guys do anything in the class sort of talking about how to handle conflicts if they arise in groups, or sort of group dynamics, or sort of preparing for that, anything like that? Or did it just sort of happen organically?
I can take this one. I believe our first deliverable was having us talk about like what we would do to resolve conflicts with each other. But I think like throughout the course, we all kind of just organically, like if something came up, if there were any disagreements, like we just let each other know, or like, rope our like professors or our TAs in. But I also had a great experience with my group throughout the whole experience. So very like minor things, but yeah.
Yeah, and to build off that, I think one of the aspects of this class that made it so easy to work with our groups, besides just increased access to each other through this platform, is the flexibility to choose a project that we cared about, and also understanding that these were skills that are directly applicable to my resume, for example. I think a lot of times in a liberal arts education, you have to think critically about what you're drawing from your class and using those skills and talking about those, say, in job interviews. But here I could confidently say, yes, I conducted a cross-sectional study, and I figured out how to distribute this survey. I know how to clean this data. And I think just having that direct knowledge makes it feel more concrete and makes it feel more attainable, that our classmates just kind of seemed more on top of it than I've had in other class experiences.
Yeah, that really came across in all of your presentations, that I could see the like passion and enthusiasm that you had for your topics. That really came across. Were there any sort of surprises that you had out of the whole experience, or sort of like epiphanies or lessons learned that you think are worth sharing?
I think we learned that when you're working with surveys and data, that as tempting as it is to provide a lot of continuous response options for people to like get everything that they could possibly get off their chest, like as tempting as that is, it leaves you with a big mess to clean up after the fact. So that was something to consider going forward.
I second that.
Yeah, I agree. I think one thing that we talked about in our team was making sure we don't go off path and start investigating a completely new research question, because it's so easy to be like, oh, well, risk perception could be confounded by X, Y, and Z. Well, maybe we can do a separate analysis. And a couple of times we had to kind of reorient ourselves and make sure we're just really honing in on one question and being able to answer that first.
Yeah, I was very surprised by how easy it is to not keep something so narrow, because as you're collecting data, you're seeing so many opportunities for further understanding. And, obviously Maddy's and Mary's group was able to look at correlations between different social media platforms, and we wanted to do the same thing, but we just thought, oh my gosh, we're going to have to spend so much more time creating so many more 2x2 tables on so many different Excel sheets that we're just never going to get this done in this 10-week time period. So yeah, it really teaches you how to keep everything concise for the sake of the project.
Jen and Kate, any like things that you want to share with fellow instructors of like joys or things to avoid when teaching this kind of class?
I can say, like, as you can imagine, this is like the most fun class to teach. It is just a joy to teach, and we are having a blast. I hope it's fun. I hope it's fun to take. I think the students who are sitting here before you would say that it's fun to take. We do have aspirations, though. We're not sitting on our laurels. And some things that we would really like to do is give students an opportunity to even add more skills to their toolbox, as Loic was saying, as they leave, and to be able to say, I also practice this and this and this, like I've done it. Here's an example of my work. One of those is to get some experience handling, like collecting and handling qualitative data. We'd really love to just do more work directly to find ways to involve community being the University of Washington populace, the people, those who are being studied in the development of the research questions, advising us, community sensitization, and being a part of the research process as well. And some of our groups have done that. They've partnered with the Q Center, ECC, registered student organizations to do that as part of the research work. So we'd really like to do more of that. And this is, and I cannot say enough for our teaching assistants. They're not here on with us, but they are the heart and soul of this endeavor. They are so amazing. We really, because this is such a great teaching experience, we are very fortunate to I wouldn't say we have our pick of the best TAs, but we get amazing TAs who really are committed to teaching and learning to teach and becoming teaching professionals. And so we'd really like to think of ways that we can support this as a TA development opportunity for their own professional path, because they really get such deep mentoring, really deep teaching experience as part of this. And they also just pour their hearts and souls into this class. So I want to send a big shout out to them as well.
Yeah, I would echo that. Our TAs are phenomenal. I mean, really impressive. And it's a learning experience for them, because it's sort of, we all work together as an instructor team very collaboratively, but then we also have our own coaching groups. So we each are responsible for 4 of the student groups in the class. So they really have a lot of independence as well. And we all kind of take on our own roles within the class, and it works really nicely. It's been a very functional team, I have to say. These are my first 2 quarters teaching with this group, but it's really fantastic. And I'm just want to say how proud I am of our students. I think you guys were like, I was like getting teary when you guys were all talking. I'm like, they're so amazing, but they really, it's an incredible amount of work, and they're so dedicated, and the public health students are just really fun to teach. As Jen was saying, the current group right now today had their last lecture, and I was just I was hoping that they are now in the place where you all were just 3 months ago, where they can kind of look back to the beginning of the process and see this whole process start to finish as, you know, as a real accomplishment, but then also as they go forward into their next career move, whatever that may be. If they're using any kind of, you know, survey design or research development, they can they have a better perspective on kind of what it is that they're doing, and they have that whole longitudinal sort of experience. So yeah, I don't know, just it's been a really fun experience for me as an instructor too. So thank you all.
Well, thank you so much to all of you. I can't remember who suggested this, but whoever did, thank you for suggesting it. I'm sure they're watching and enjoying it. It might have been Juanita who suggested it, but whoever it was, awesome. It was super fun. Really appreciate all of the students coming and presenting during week 10. Huge, because I know this is a stressful week for all of you. It was super inspirational to hear everything that you guys had to say, and lots of really interesting results. And thanks, Jen and Kate, for running such a great class and sharing them with us. As a final word, since we're 1 minute over, I just want to remind people, even though we're doing great in terms of starting to get people vaccinated in Washington State and case counts are down, they are still high. So as you head into spring break, please make sure that you are wearing your masks and social distancing. We need to do that as long as we have members of our community, significant numbers of members of our community who are not vaccinated still. And if you are traveling over spring break, of course, we're hoping that people still are sort of limiting their travel for a while until we get better vaccine coverage. But if you do travel, we hope that you will participate in the Husky coronavirus testing program when you come back, to make sure that we catch cases early and don't get another surge. So with that, thank you so much, everybody. That was totally awesome. And have a great end of your quarter and a wonderful spring break.